to talk to you today. I want to talk to you about the retreatment rates and the comparison of Navilas combined with anti-VEGF treatment to anti-VEGF monotherapy. First, let me say we had the chance to work quite early with Navilas since 2005, and it's very nice to see that there's getting more and more evidence that this technology leads to a better treatment for our patients. In the early beginning, easy questions had to be solved. The first question was, is this technology an accurate and safe technology? And in accordance with the data we already saw from Professor Freeman, we were able to show that it's a highly accurate tool. About 96 of treatment spots are within a 100 micrometer target. As a positive side effect, we found out that it's a more convenient treatment for our patients. It reduces pain, the pain is significantly reduced compared to conventional laser. I'd like to go a little bit deeper into that because that's very important because, as you know, diabetes patients, patient compliance is one of the most important things for successful treatment. So what did we do? We compared a group of conventionally treated laser patients with Navilas treated patients, and we showed them a visual and a log scale and asked them how was their feeling of pain. And the conventionally lasered patients voted with 4.4. Well, this is pretty high because in focal laser we don't use too much energy that could result in pain, but the contact lens and this light and things like that induce fear. In Navilas, you don't need a contact lens and you have a very rapid treatment, and that resulted in a significant less feeling of pain during the Navilas treatment. The more important question is, does this new technology result in better outcomes? We investigated that and compared Navilas treated patients with conventional laser treated patients, and we found out that less retreatments are necessary. We compared these 46 patients treated with Navilas with 120 patients treated with conventional laser, but it's always very difficult to compare apples and pears, and therefore we used a prosperity score matching, which is a highly sophisticated statistical method to bring these groups together. And what we found out that with Navilas, there's almost 50% reduction in retreatment in an 8-month follow-up period, and this is a pretty good result. Laser was the gold standard in DME treatment for many, many years. However, things have changed a little bit, especially in fovea involving macular edema. Anti-VEGF has taken over, mainly due to the better visual outcome. With laser alone, we don't get much visual acuity improvement. With anti-VEGF, we get both. So our question was to evaluate the gold standard now in fovea involving diabetic macular edema anti-VEGF treatment, which is approved in Germany, Lucentis for DME treatment, with a combination of anti-VEGF and navigated laser treatment, and to look at if it is possible to receive comparable results regarding visual acuity, but maybe get a longer extension of injection-free period while maintaining the visual improvement. So we included patients beginning from early 2011, and what we did is first we tried to reduce macular edema with anti-VEGF injections. In general, we took 3 initial anti-VEGF injections, and after the 3rd injections, we did a focal navigated laser treatment in order to stabilize the situation. So first, let me say, in many, many cases, it works. Here we have a case with a more or less diffuse type of macular edema starting with 18 letters. We get the 3 injections, and you see a rapid increase in visual acuity, reduction in central retinal thickness. After the 3rd injection, we did a focal Navilas treatment and then followed up. 1 month after laser treatment, visual acuity is still good. 3 months after laser treatment without any re-injection, visual acuity is even increasing a little bit, and even after 9 months, 12 months, including the injections, this patient was stable. So we tried to compare a little bit statistically those patients who had a combined treatment with Navilas and anti-VEGF, and we took standard anti-VEGF arm. As already said, in Germany, Lucentis is approved for treatment of DME and is reimbursed. And when we look at the basic characteristics, there were no really significant difference. We followed up the patients for 1 year. Not all patients reached until today the full year, but we have patients who were longer in this period. When we look at the early results, we see even after 3 months after the laser treatment, visual acuity stays stable after the increase in visual acuity of anti-VEGF injections. The same with central retinal thickness. We have a fast reduction of macular edema, and it's maintained after Navilas treatment without re-injection. So when we look at the visual acuity outcomes, you can see there is no statistical difference in between the groups. That means those patients who received a combined treatment with Navilas and anti-VEGF have a comparable visual outcome compared to those who had Lucentis monotherapy. But when we look at the retreatment rates, we see a highly significant difference. Those patients who had the combined treatment received, in most cases, only 1 or less injections in 1 year period of time after the 3 initial injections of Lucentis. More in details on the visual acuity. So we have comparable visual results compared to the anti-VEGF monotherapy, but a strongly reduced need of anti-VEGF after the initial loading phase and navigated laser therapy. So let me conclude. With the combined treatment, visual improvement is comparable to an anti-VEGF monotherapy, and our results from the monotherapy arm are comparable to the RESTORE study results. However, less injections are needed, and this is maybe a great advantage for our patients and for us. So this is only a small case series. Longer follow-up is needed, but I think this is very interesting and will bring us far in the future. Thank you very much.
Great. And our final